Good morning everyone. I am Dr. Navoday Gilla, Senior Consultant Physician in KIMS Gachibowli. I am here to tell about heat effects. As the summer is coming and the temperatures are rising very fast, I am here to enlighten you with the effects of heat. There are three types of heat problems that we usually face in our day-to-day life. Those are heat cramps, heat exhaustion and heat stroke. Heat cramps are the milder form wherein many people will face the pains in the muscles. It is because of mild dehydration that is due to heat. And heat exhaustion, it is bit severe form of heat effect which is next to heat cramps, wherein the patient will be having temperature, nausea, weakness, tiredness, headaches, and the severe form which is called heat stroke. It can be such a severe extent that it can be even life-threatening also. There are two forms of heat stroke wherein classical, that is non-exertional and exertional. Non-exertional form of heat stroke is that where there is heat environment in and around. Usually this causes severe effect in children as well as elderly. These are the two categories wherein the effect of heat stroke, non-classical or non-exertional type of heat stroke. The exertional type wherein we work out more in the hot environment, something like working outdoors, athletics, marathon, something like that. So what is the symptomology of heat stroke? As it is severe form of heat stroke, your temperatures can be very high as more than 104. There is no sweating, confusion, heart failure, liver failure, the muscle enzymes from the muscle is coming into the blood circulation, causing rhabdomyolysis, kidney injury. So what do? There are some prerequisites wherein there are risk factors where some patients might be using some tablets or some drugs which are a predisposing factors for heat stroke, like diuretics, antipsychotics or CCBs. These are the common medications which can cause the heat stroke. So in which category of patients or people the heat stroke or the effects of heats will be more? Usually it is younger and elder and people with comorbidities like diabetes, hypertension, renal failure. And what are the clinical manifestations? As I told you, it is cramps or heat exhaustion or heat stroke. The severity of symptoms are going to increase. Simpler way to identify the dehydration at home is urinary concentration, that is the color of urine. If the color of urine is yellow and dark, as the darker shades, you are severely dehydrated. So it simply indicates that the person who assumes that he is taking lot of water or fluids should take more water than what he is usually taking. As a doctor, what do I tell patients as a preventive aspects what to do? See, unless otherwise if it is not required, better not to go outdoors during the sunny times. If required, then go under the help of umbrella or wear lighter clothes and keep yourself hydrated with different type of fluids like water, coconut water, buttermilk and fruit juice. These are all things that will help you to keep hydrated. And if a patient or if a person goes from heat cramps to heat exhaustion and finally to heat stroke, what do? First, we need to immediately put the patient into shady areas, remove the clothing and make his temperature to come down, like cool clothing should be covered immediately. And at a hospital setting, give IV fluids, measure the rectal temperature, do blood tests to see the severity of heat stroke like CBP, RFT, LDH, CPK and ECG. So once we are done with the preliminary treatment, we try to assess the severity of heat stroke and keep giving IV fluids so that the patient will recover fast. As a doctor, I do tell every patient of mine to be on a preventive aspect rather than coming for the help to our doctor for the treatment. In fact, what the prevention should everyone do is keeping everyone in colder areas, taking lighter clothes, keeping yourself hydrated with lot of fluids. If required, go out and help of umbrella and take medications as and required due to the old medical problems what the patient is suffering.